From anatomy to anesthesiology, from pathology to pharmacology, from microbiology to medicine, a one-man resource to the world of health sciences. Welcome to Dr. Paul's Medical Lectures. A practicing physician, Dr. Paul offers you essential insights on diseases afflicting millions of people around the world. For today's lecture, here is Dr. Paul.
Today I want to talk a few minutes about shingles, that is herpes zoster. A very important topic. So let me enumerate the most important points. Herpes zoster is an acute vesicular eruption due to the varicella zoster virus. It usually occurs in adults. And there are exceptions, of course, but most of the times it gives only one attack. And many people think that there is some kind of malignancy when we get herpes shingles. Need not be. And many times we should usually think more about HIV than malignancy in these patients, because HIV infected patients are 20 times more likely to develop zoster than other people. Okay, so think about HIV or other immunosuppressive disorders like Hodgkin's disease. So the pain usually precedes the eruption by 48 hours. So many times they just talk about pain and you have to wait to see the vesicles. And the lesions consist of grouped tense, deep-seated vesicles. So there are vesicles distributed unilaterally along a dermatome. So you see a dermatome and you see these vesicles, and they are mostly on the face or on the trunk. Then that is herpes zoster. What about the differential diagnosis? Think of poison oak or poison ivy dermatitis, because they also occur unilaterally. So they must be differentiated at times from herpes zoster. And also allergic contact dermatitis. Allergic contact dermatitis is pruritic. Herpes zoster is mostly pain. It's not itching, it's pain. And you have to differentiate between herpes zoster and herpes simplex. And occasionally, when you get herpes zoster on the face, you might think about erysipelas. And many times all you have to do is to start them on an antiviral and see for the response. If it is zoster, you will see a response to the disease. But if it is not, it is just erysipelas. But herpes zoster is unilateral and it comes with vesicles preceded by pain. And many times that's lead to the pain comes first, even before the vesicles, and that leads to misdiagnosis many times. If it comes on the chest, you think of myocardial infarction. If it comes on the belly, you think of acute appendicitis. In the back, herniated disc, or in the face, you think of migraine. You have to wait in those circumstances until you see the vesicles. Once the vesicle comes, things become clear. So folks, think about the complications also. And the complications, and the most important one, is post-herpetic neuralgia. Okay, remember, post-herpetic neuralgia is the most common after the involvement of trigeminal nerve. And whenever the patients are like above 55, they have this problem, and you need to treat them aggressively because it's a very painful condition. And so when you see a patient like over 60 years old, offer them a Zostavac, that is the vaccine, herpes zoster vaccine, a live vaccine, Zostavax, now available. And please offer them to all patients above 60 years old, because it prevents the post-herpetic neuralgia. And so when you see patients over 60, think about Zostavax. Now what about the treatment? treatment, there are, first of all, you can start with medications. Treatment it can be given with oral acyclovir 800 mg 5 times daily, or famciclovir 500 mg 3 times daily, or valacyclovir 1 gram 3 times daily, and all for 7 days. And the patient should maintain good hydration. The dose of antivirals should be adjusted for kidney function, because most of these antivirals affect the kidney. And if the pain is so severe, you can use nerve blocks depending on the area it involves. When it involves the first branch of trigeminal nerve, you should go for an ophthalmic consult, because these people might lose their eyesight. And you have to use systemic corticosteroids in reducing pain. And when they complain of a lot of pain, you give them acyclovir or any other antiviral, and you have to give them corticosteroids also. And they do not increase the risk of dissemination in an immunocompetent host. So you see, folks, these are the main points in this disease. So start with oral acyclovir and think of corticosteroids, nerve blocks, and you can also use other things like oral corticosteroids, and they do not reduce the prevalence, severity, or duration of post-herpetic neuralgia beyond the effective antiviral therapy. So those are the important points. And what about acyclovir resistant? If they are acyclovir resistant, give foscarnet. So foscarnet, giving like 2 to 3 times daily intravenously, is indicated in the acyclovir resistant varicella zoster virus infections. And local measures, you can use calamine lotion or starch lotion to reduce the problem. So remember post-herpetic neuralgia, and think about the therapy. The most effective treatment, as I said, is prevention. Prevention with the vaccination, Zostavax. And that's the first step. And then antiviral therapy, once zoster has occurred. Once established, post-herpetic neuralgia may be treated with capsaicin ointment or lidocaine topical application, like a lidoderm patch. Take a patch and put on the skin, and that gives a lot of relief. And sometimes they get so much pain and you have to do the nerve block. And these are the most important things. So antivirals like acyclovir, then you can try steroids, then you can try capsaicin, you can try nerve blocks, you can try gabapentin like 300 mg daily. You can also try amitriptyline. Amitriptyline also works for this pain. So, and you also refer to pain management if you can't deal with it, because it's a painful condition. As I said, consult specialist groups like ophthalmologists whenever there is the involvement of the first branch of trigeminal nerve. And what is the prognosis? The eruption persists like 2 to 3 weeks and usually does not recur. And motor involvement in 2 to 3% may lead to temporary palsy. So that's about herpes zoster, the shingles. So please note these most important points. And if you have any important points, please post them so others can read and prepare well for the examination. Thank you.
Thanks for listening. For more medical videos, please visit us at www.drpaul.org and take time to browse through hundreds of health videos we regularly post on our site. If you are preparing for USMLE, PLAB, and other medical exams, make sure you visit our website to browse through our videos explaining the essential points you need to know before taking these examinations. For more information, visit us at www.drpaul.org. Thank you, and may God richly bless you. you. Are you preparing for USMLE? Please do not waste thousands of dollars on training courses. Get the books written by Dr. Paul with the student-to-student tips and memory aids. The success will be yours, and you will soon realize your dream of becoming a physician in the United States. If you are preparing for Step 2 clinical skills, study USMLE Smasher, a guide helping thousands of medical students to pass this examination. For more information, visit us at www.drpaul.org.